Welcome to Generations Radio, where the focus is on our seniors and their families. We are here each Saturday afternoon from 5 until 6 p.m., bringing you resourceful information with our radio team of professionals in the field of aging. Stay with us for the next 1 hour as we explore different ways to make life more exciting and meaningful for our extraordinary seniors. Right here on AM 690 The Answer. And now, here is our host and the publisher of Generations Magazine, Percy Ihara.
And welcome back to Generations Radio. I'm Percy Ihara, your host, and thank you for tuning in this weekend. It's March now, and if you haven't picked up a copy of the Generations Magazine, please do. You can see like a older picture of a dance couple on the cover, and if you can really tell me who that is before you read the story, I'll be very impressed, unless you're a ballroom dancer. This is Benny and Faith Agbayani, who had the Hawaii Ballroom Association, and if you figure out the name, it's Benny Jr.'s parents, and the baseball player that played for the Mets and for St. Louis. So thanks to Benny and Faith. I appreciate you posting all over social media, and if you get a chance on Oceanic Spectrum Channel 12, we have our Generations TV, and it is featuring part of their segment on our Generations TV show. So check it out along with the magazine. And just want to let you know, if you haven't seen it yet, all the Times pharmacies on Oahu, all 12 of them, you can pick up a copy at their pharmacy location inside the store. So it's going very well. We are running out of magazines going forward, and so please make sure you get a copy. If we do run out, if you go to a rack, if you go online or your smartphone, go to generations808.com, and you can pick up all our past issues. But this issue is really nice. When I found out about them, and I found out that it was Benny's parents, of course, with the name. Great couple. They're still active with the Ballroom Association. I believe they have 500 members, and they're just great to be around. So Benny Jr., you're very fortunate to have parents like this. So anyway, for those of you that may be new to the show or new to the magazine, Generations Magazine was started 8 years ago as a resource magazine. And we've really grown in 8 years now. We really touched a bigger part of the 50-plus marketplace statewide. And I really thank all our readers and listeners, and especially our sponsors and our writers that write for the magazine. So I want to thank all of you. Today, as people that know me and know the magazine, we're very proactive. And so one of our sponsors, Kuakini Hospital, has really been coming on board. And thanks to Donda and, of course, Terry here. We really like healthcare. We really like trying to get people to stay healthy, and if not, get healthy. And so, people know, I've talked about my surgeries on my shoulder 3 years ago, and physical therapy. And then I said, we need to get a doctor from Kuakini to come on board and talk about Kuakini's orthopedic department over there. And we found one, an athlete himself, Dr. Darren Awaya. So, Darren, thank you, and welcome to the show.
Yeah, Percy, thank you for having us.
And I know you're still young, but most of your patients must be over 50 with having spinal problems, right?
I think that a vast majority are older. Yeah. We treat more degenerative problems than anything else.
And so when you say that, we're going to be all over the place, because that's kind of how I think. I talk kind of fast, and my cousin goes, you just think really quick. And I think I do. I'm not the smartest guy around, but I like to think about different things. And when I hear things like degenerative, what do you mean by that? I mean, is that something that mostly females get involved with because of osteoporosis? Is that correct?
No, something a little different, actually. It actually caters perfectly to what your magazine is about. It's about the aging population. And degeneration meaning more of an aging spine rather than something that happens traumatic, like a car accident.
Okay. So how long have you been in Kuakini? Well, let me back up. So I heard you're Iolani graduate?
Wow. Yeah, Iolani, class of 90.
Oh, I think I know a few guys. Now that I think about it, off the rail, I'll tell you about them. And so Iolani, then you told me you went to UCLA. I'm sorry.
Yeah, not USC.
I almost said UCLA.
UCLA is definitely not USC.
Good for you. And then you came back to Hawaii, or you practiced on the mainland?
No. Well, I came back to Hawaii for medical school. So John A. Burns.
Oh, okay.
Finished medical school there, and then went up to Sacramento at UC Davis for residency and fellowship. And I did an orthopedic surgery residency and then a year of spine surgery fellowship. I practiced up there for about a year and a half, and then decided to move home.
Oh, well, I don't know if you've lived different parts of the mainland, but I've lived East Coast, West Coast, and it's hard to beat Hawaii's quality of life. I gotta say that,
Yeah, you can't beat the weather and the people and
The food.
the food, but you can definitely make a better living in the mainland. It's a lot cheaper.
Yeah, but I always tell people, can you put a dollar value on the quality of life?
Yeah, no.
So anyway, Kuakini. So what got you involved, and why was spine? Because I know shoulder people, hip people. Why the spine?
Actually, the path that led me into spine surgery was a little bit personal. When I was a senior in high school, I broke my back at Sandy's. Injured at bodyboarding in the shore break. Had a hard time walking for a few months actually. Saw the late Alan Richardson, who diagnosed me with a stress fracture in my back, and luckily it healed. I didn't have to have surgery. It was just bracing and physical therapy, and it all worked out for me. But when life gives you those types of lemons, you tend to make lemonade out of it. And I also had other injuries, like I hurt my shoulder surfing and was also in Alan Richardson's office, and broke my ankle in Alan Richardson's office. And so orthopedics became natural. And then after I got into an orthopedic surgery residency, spine surgery was just a natural progression for me.
Plus, you have experience with the pain people going through. And
empathy, yes.
I get it. So Kuakini now, I know you have a great orthopedics department over there, but you're specialized in spinal procedures. And so we were talking about before we came in, so people would typically talk to the nurse, talk to their general practitioner?
Correct. The standard pathway to get to a spine surgeon typically goes through your primary care physician. The primary care physician will try a few basic things for the general pain. If that tends to fail, then you get referred to maybe a physical therapist, or even get advanced imaging like an MRI. Once there's a problem that the primary care physician can't take care of, then you usually get referred to, a specialist like myself.
So you talk about degenerative. So like one of the questions I want to, so like I have back issues. In fact, I had one I was telling you yesterday, big from playing golf that I had to go play softball last night, and I just really had a hard time. It got worse and worse and worse throughout the night, like from 7 o'clock to like 8:30. Really, my back's really started getting sore. So is that something that I would see a doctor for, or just take a few ibuprofens and call me tomorrow?
I think in general, 90+% of the American population suffers from back pain at some point in their life.
Really?
Yeah, it's that high. And most people do not seek medical attention. Most people, it's over-the-counter anti-inflammatory, rest, maybe go get a massage from, some local referral, and that's about it. The back pains that persist for more than a few months, or even a few weeks to a few months, definitely would require medical attention. There are also other warning signs. So if your back pain is limited to your back, it's not such a big problem. But if you start getting pain that radiates down your leg, or pain in your buttocks, those tend to be things that are more related to a structural problem in your spine, and not just a muscular problem that will ease itself.
Okay, so you talk about muscular versus the joint or the bone itself then?
Correct.
Okay, so when would be a time where I think it might get serious, or something I need to go talk to a specialist? When would that happen?
I think, like I said, the chronicity of your problem. If it's self-limiting and you get a back pain every couple of months, I think that's more than well treated by yourself at home. The googledoctor.com type of thing. But, if you become worried about it, or if you just feel like you're not satisfied with the quality of life that you're having and you want to seek something better, then obviously medical attention is where you would go.
Yeah. But medical insurance covers all this, right?
Correct.
And so the typical, you talk to a nurse, your general practitioner, then maybe a specialist, and then they'll say, well, what choices do you have? Physical therapy, exercise, diet, lose some weight, or surgery? Yeah,
so I think when you think about back pain, it becomes very generic. People think all back pain is the same, similar to all headaches are the same. But the reality of it is, when you see a specialist like myself, we tend to think of back pain structurally. So we say, is it a muscle? Is it a bone? Is it a joint? Is it a pinched nerve? Is it a disc? And we try and break down your pain to the exact cause of the pain. Once you can do that, then you can kind of identify the treatments that need to be taken for each specific problem. Like I said, things that are muscular, tendinous in nature don't really require a spine surgeon. And those things do tend to get better on their own.
And so when you talk about risk of spinal surgery, that's kind of high. Isn't it kind of a higher risk besides heart surgery?
Yeah, it's a high stress environment, but I think the connotation of spine surgery has always been negative. I think in general, people, hang out at Zippies and talk to each other and say, don't have spine surgery. Don't let anyone touch your back.
Well, do you know the percentage or the percentage of risk? Like, is it 70% of the time successful? Is it 80%?
I think that the complication rates for your standard operations are very low. I think those are on par with complications for things like total hip replacement or total knee replacement. Spinal fusions for instability, I think, are very, not generic, but very common procedures, so the risks are very low. There are other things that we do that are very high risk, things like scoliosis surgery, where somebody has a very crooked back and you have to do an extensive realignment of their spine. Obviously, things like trauma, car accidents, then they have higher risk. So the surgical procedures are more related to the actual disease process. But your average low back pain with, pinched nerve type symptoms, the complication rate, I would say, is less than 5%.
Kind of scaring me with his scoliosis and crooked back, because I've seen some of my clients like that, and it's pretty painful. Can you live with something like that, or is just surgery the only option for you?
Like any other problem, there's the degree of severity. And spine surgeons, we use a lot of objective measures like numbers. And we say if your curve, which is the size of the scoliosis, is less than 40 degrees, we treat that without surgery. Curves that become bigger than 40 degrees, which are probably something that you'd notice. If somebody is walking down the street, if you can tell their back is crooked, their curve is probably bigger than 40 degrees. Those type of people have a propensity to increase in size. The curve actually gets bigger as they get older. And when it gets bigger, then it becomes more of a problem for them, even just standing upright, taking a deep breath, the pain that's associated with being crooked. And those people tend to have a little bit more, not just cosmetic problems.
So I always ask general questions like anybody off the street. So when you say 40% degree, is this like left or right, or is it forward?
It's
you see
all
a lot
directions.
of seniors, really.
Yeah.
You see a lot of seniors, they hunched back, and I was like, God, how does somebody walk and live life like that?
It's difficult.
And when they lie down, how do they sleep if they're always hunched over? I know one guy I always see at a meeting, and he's like 80 years old, and man, he's always like that. How does he live like that? I see him actually once in a while walking in the Ala Moana area, and it's like, wow.
Yeah, I had a patient who was suffering from lymphoma. And the lymphoma, which is a type of cancer, had eaten away at some of his bones. And it had made his back really hunched. That typical scenario where you see the person like the hunchback type of person. And we did a surgery to correct that posture. And we did it for pain, and we did it to remove the tumor. After surgery, his biggest compliment to me, or his biggest success, was the fact that he said, "Doctor, for the first time in 5 years, I can lie flat on my bed."
There you go. I was wondering about that. And so that was pretty successful there for him.
Yeah. Now, he's not perfect, but he definitely would do it again.
Well, it's definitely a life-changing event.
Yeah.
Well, we're here with Dr. Darren Awaya from Kuakini. So if you're tuning in, look in the magazine. I think in this issue, what page was it on, Ryan? Your Kuakini ad there. There you go. You're on the right side, I think, somewhere around page. Anyway, we'll find it.
Middle of the.
Yeah, look for the Kuakini ad. But yeah, Kuakini does a great orthopedic department there. So I wanted to, we have a second half of the show to go on. I want to spend a second half of the show going on specifics. But what are some of the general different types of spinal surgery? Because you had mentioned, if it goes down to your knee or your legs or your hip, or the different types of different spinal surgeries?
Yeah, I think not to oversimplify spine surgery, but it can be broken down in two types of operations. One operation is to decompress the nerves of the spinal cord, and the other operation is to stabilize the spinal structure. So when you have pain that goes down your leg, you tend to have a pinched nerve, and that usually just requires a small outpatient type of procedure to unpinch the nerve. It doesn't require anything like metal implants or hospital stay. It's very straightforward.
Well, you just release the
anything that's
pressing
on the
nerve. Oh.
If you have,
because I know a lot of people that have that. I'll be honest with you.
Common.
I could probably mention 10 people that I know personally that have that problem. Is it that common?
Very common.
Really? And what causes that?
Again, it's mostly a degenerative process. Now, so as your back ages, the spine becomes slightly unstable, sort of like the rocking of a chair with one leg too short. Okay. That rocking of the leg is tolerable for most people. They feel, it wobbles a little bit, but it's not a big deal. When that wobble becomes a little bit more and the chair tips to a certain degree, you feel unstable. You feel like the chair might tip over. Those types of instabilities happen in your spine as well. So as you age, the back gets unstable as to a slight degree, to a greater degree, and to the point where you feel like something is wrong. That's usually when people say they don't have confidence in their back. They feel like they can't run as fast as they used to, or twist, or hit a golf ball as far as they used to.
I still can. I just don't hit it as straight.
That's another problem. Yeah. But when the spine becomes unstable and it starts touching the nerve, whether it's a bone, whether it's a disc, whether it's a ligament, something in your spine starts touching the nerve, you get pain that goes down your leg. For the most part, that instability is tolerated, so you don't have to do any kind of crazy operation to stabilize it. You just have to unpinch the nerve. And so that's the decompressive side of surgery, simpler side. The more involved side happens when that instability becomes a problem, where by just cleaning out the area for the nerve is not enough. Then you have to actually put something in to stabilize the spine, whether it's in your neck, whether it's in your back, whether it's in your chest. Something has to go in to stabilize that spine. Those are the fusion type operations. Those are much bigger operations, obviously. There is a third category that is sort of new, but not really catching on as much as we'd like. Those are replacement parts, so much like a knee replacement, where you can take a portion of your joint out and put something that moves in. That is something that it's available. It's commercially available for sure, but it's not.
Really?
Yeah, but it's not something that it gets done as frequently as the other two.
Is it
operations.
safe though?
Yeah, it's very similar to the other operations.
Is it being done now in Hawaii?
Yeah.
Oh, I know a couple months ago I believe it was the first week of November of last year. They had the Pacific Regenerative Conference at the convention center, and they're actually going to have another one in February of 2019, where they brought doctors from around the country and the world. Actually, they brought a 3D printer. They talked about regenerative medicine and stem cell, but one of the doctors from another hospital was on a couple months ago talking about the future of healthcare. And these procedures now, that maybe not so much done here, but they will be seen done, and maybe that's one of them where it's is it the future of how to solve these back problems with this kind of procedure?
Yeah, I think that at some point in time, spine surgeons may be obsolete.
Is it because of the teeter-totter thing you can buy at Costco, you can lay upside down?
No, I
have one of those. Don't laugh, Chaz. I do.
I think it's more along the lines of, the fate of the cardiothoracic surgeon. When I was in medical school in the 90s, you would go to the operating room and you would see heart bypass, heart bypass, heart bypass.
Right.
Those were like the most common operations being done at every hospital in the state. And to the point where I actually thought I wanted to be a heart surgeon, because I figured it was a nice operation. I liked surgery, and it was the most common thing being done.
Right.
Well, luckily I did not go into heart surgery, because heart surgeons are having a hard time finding business now, because it's all been replaced by these drug-eluting stents.
Yes.
And it can be done minimally invasive through your groin. And although they're still very necessary, there's just not the volume of work. I think that spine surgery will happen. That will eventually happen, although it may be a generation away, where you could inject a chemical into the disc space to fuse it, rather than putting metal screws and rods, which will seem archaic at some point in life. But maybe there is even a stem cell that could regenerate the disc instead of fusing it itself. So I think that in the future, spine surgeons could be looking for employment too.
I think that's the truth. I think according to the conference, actually, I was supposed to be at the conference. I was supposed to announce the guest speakers, but I actually got shingles that week, and I was only 58 at the time, 57, and you don't take the shingles shot until you reach 60.
Correct.
So I would say you don't need it yet, but I didn't take it, and I got shingles in that week of November. And after talking to so many of my friends, I can say at least 10 people under 50 got shingles. But I thought it was supposed to be mostly over 60 people would get shingles, but it put me down for about 10 days. And anyway, but
yeah, I guess shingles doesn't discriminate, huh?
Oh no, not. And it's interesting. I would say about 40% of them were women. So women that have a high stress, I know like 3 were in their 40s got shingles. And yeah, a scary look there. Yeah, it's painful. It's very, very painful. And you're out. You don't want to do anything. Don't want to move because it's very painful. And most people get it around the chest, which is interesting.
Yeah.
But
Are you better now?
Oh, I mean, the scarring, but yeah, I'm fine. But it was interesting that because of you talking to you, that my back was sore for like about 2 weeks before it came out. And I thought it was my bed. Well, it probably was my bed because we just got a new bed. But they say the shingles comes out of your spine. It hibernates in your spine area.
Yeah, it's latent in the nerves that come out of your spine. And oddly enough, the rash follows the nerve pattern. So wherever that nerve goes is where you will see the shingles come up. And so a lot of patients that we have for spine surgery will complain of pain in similar distributions. So one of the first thoughts before you can see a rash, or if somebody comes in to have pain that goes around their flank, is you think they have shingles before you have anything else. And I would say that 9 times out of 10 you're wrong because they don't have shingles, but it's at least a thought.
It's interesting because that's what comes out.
Correct.
And I don't know if it always starts with a back problem, but yeah, my back was sore for about 2 weeks, and sure enough, I went swimming that morning. And I took my shirt off, so I was fine. In the afternoon, I changed shirt and something, and I saw it on my side of my chest, and I go, "Oh my God, what is that?" So I took a picture of it in technology, texted to my nurse practitioner friend Steve Ito in a magazine, and he goes, "Oh, that's shingles." I said, "I'll prescribe medicine right now." So my wife went down to the pharmacy within about an hour and picked it up and caught it very, very early. So, but it still was 10 days of pain.
Yeah.
It was.
I've never had it, but I've seen people with it, and it seems miserable.
Well, all I can say is I have a very hectic life and I have a young son, and so if you have a hectic life and you're stressful, I would tell you take it. I would get it before you're 60 because if you cannot afford to be down for about 7 to 10 days or 2 weeks, I would get the shot. But anyway, so regard to different types of therapies besides physical therapy, and I'm mentioning aqua therapy. What other things can people do if they don't want to say surgery? Because I know a couple of people right now are thinking about back surgery, but they don't want it.
Yeah, obviously spine surgery is the last stop on the train. It's conservative management should be exhausted before you do any type of operation. It doesn't matter if it's spine surgery or joint surgery or an elective procedure. The treatment options for spinal problems, again, tend to be more related to helping the body with time. So it's the pain that really guides your treatment. People can't tolerate the pain of, in their backs. They're laid out for a week, 2 weeks. They can't even go to work. So we do things, medicines. Medicines are always the first line of treatment.
Like painkillers or something?
Yeah, so in the
muscle
we
relaxants?
used to use painkillers a lot more, and we've gone away from that because of the current opioid crisis that's occurring.
Oh, huge.
But the anti-inflammatories and steroids are the mainstays of treatments for taking away inflammation. There are also newer medicines for nerve pain that we tend to utilize if you have more of that pinched nerve type of symptom. And that's the easiest way to sort of get people comfortable. Once they're comfortable enough, then they can actually participate with other treatment options like physical therapy. I know you mentioned Moon physical therapy and aqua therapy. It's great for people who have back pain because they can't stand up. The weight of their body hurts. The progression from physical therapy gets a little steep at that point, meaning you're sort of running out of options that are non-invasive. Mm-hmm. Back braces, the teeter hang-up that you mentioned, chiropractic maneuvers, acupuncture, those things all can be tried. The unfortunate thing is if you have a structural problem in your back, none of those things fix the structural problem. So you end up back at square one where you feel better and then all of a sudden it comes back. And then you go back on the medicines, you go back to the physical therapy, and it becomes sort of a chronic treatment protocol for non-operative back pain. I think at some point you springboard out of that because you can't take it anymore. You say, I'm tired of dealing with pain every day. I can't be on the go and then be laid up and on the go and laid up. And I think that's where you get things like advanced imaging, MRI, CT scan, to go and actually find the actual problem. The option that is the last step before surgery typically tends to be injections. So there are non-operative non-invasive steroid injections that can settle, the nerves.
That's not cortisone, though.
cortisone is part of the combination. They also have things like radiofrequency ablation where they burn the nerve. They have spinal cord stimulation now where they try and modulate the nerves. I don't know that these are highly successful long-term treatments. And that's unfortunate because if you could get rid of the pain and it lasted for 2 years, you would never need to have spine surgery. Just keep doing those procedures. But they are definitely options for people.
I think with people living longer, I don't think 2 years is a long-term solution. I mean, I was reading a study recently where a good portion of our generation, well, your younger generation, is average age is going to be 90 years old. And the kids that are being born now, it's going to be 100 years old. That's where medicine's going. They say that somebody had quoted there's somebody on this earth right now who's going to live to be 150. That I don't know about, but I think 120 is coming. Some life insurance companies are actually on the actuarial table. When you buy life insurance, usually to 100 years old, some of them are now going to 120. That's the future. We see that. So we're here with Dr. Darren Awaya from Kuakini Hospital on their orthopedic department there. We're going to come more and talk more specifically about the different types of surgeries and different types of back, from your leg to your neck and your shoulder and your stomach and everything else along the way. But anyway, we're going to take a short break and we'll be right back.
We will be right back with Percy Ihara from Generations Radio. If you have any questions or want to be part of our discussion, give us a call at 296-5467. That's 296-5467. This is Generations Radio on AM 690 The Answer.
Did you know residential care homes offer a family-oriented atmosphere? At Caregivers Heart Hawaii, our kupuna become part of the family. The smaller environment allows for more personal attention. For example, there's no waiting to go to the bathroom compared to other long-term care options. The patient-to-caregiver ratio is smaller and help is faster. Over time, residential care homes are less expensive compared to other long-term care options. Our caregivers are experienced and enjoy what they do, and all homes are ADA approved. Don't feel stressed and overwhelmed or try to do this alone. Aloha, I am Ku'unani Demonte with Caregivers Heart Hawaii. Let us help you with all your care home placement needs. Caregivers Heart Hawaii has knowledge and experience. For a free consultation and to learn more about us, go to caregivershearthawaii.com, where treating kupuna like family is our business.
When you feel like Vegas, there's just one place to stay. Grab a drink at the Holo Holo Bar, there's just one place to play. We got a fresh, hot look, a new sports book. We got those local meals, just like Auntie cooks. Aloha spoken here.
Check out the Cow's new renovated look and see why the Cow is Hawaii's favorite place in Vegas to stay and play.
Moon Physical Therapy is here to help you back to recovery. Moon Physical Therapy is located on Ward Avenue across from Sports Authority. Physician prescribed for motor vehicle accidents, workman's comp, or that body pain that comes from rushing to play without warming up. Also event cardiopulmonary rehabilitation with our one-on-one patient care. Moon's Aquatherapy heated endless pool allows for low-impact exercise with less pain on land. We will give you the right exercises to get you back to health. Ask your doctor to prescribe Moon Physical Therapy. Moon Physical Therapy. We achieve results.
If you're new to Medicare, we can help you work your way through all the questions, the details, and the headaches. Generations TV has gathered experts in the field to help you find the answers. This is Navigating Medicare.
When it comes to Medicare supplement plans, or what we call Medigap plans, okay, these are plans that fill in the 20% that Medicare doesn't cover. And there's plans from Plan A all the way up to Plan N.
When you're signing up for these plans, there are certain times when you have guaranteed issue, the Medicare Supplement Open Enrollment Period.
Hi, I'm Ed Motasui, and I'm with Financial Benefits Insurance. We're a full-blown insurance company that deals with seniors. We help seniors understand Medicare so they can come to us, and we'll gladly help them understand all the Medicare health options.
Helping you work your way through the confusion, Navigating Medicare. Brought to you today by Financial Benefits Insurance, serving the entire state of Hawaii from the corner of Pi'ikoi and Kapiolani in Honolulu.
Oahu's newest senior living community, Ilima at Lehano, is now open in the heart of Kapolei. Within this beautiful new community, offering independent living, assisted living, and memory care, you will experience a feeling of ohana that provides a sense of community and peace of mind for our kupuna. A range of spacious apartment styles are available, from large studios to spacious 1 and 2 bedroom plans, most with a large private lanai. Be one of the first to call Ilima your home. Visit ilimaatLehano.com or call 674-8022.
Got Vegas on your mind? Get Vacations Hawaii on the line. Vacations Hawaii offers weekly 4 and 5 night Honolulu to Vegas packages, which include 3 meals daily from $6.99. Stay at Hawaii's favorite casinos: California, Fremont, Main Street Station, and Orleans Hotel. Vacations Hawaii will get you there in comfort on deluxe wide-body 767 planes with complimentary in-flight hot meal service. Vacations Hawaii's frequent flyer program gives you future travel discounts and credits. So if you're ready to win big, call Vacations Hawaii at 591-4777 or visit PointVacationsHawaii.com.
Hi, I'm Margaret Wong with the Copeland Insurance Group. Let us be your Medicare resource throughout the year. We have agents throughout the islands to be of assistance to you. So if you have Medicare questions, we have the answers. Call us at 808-591-4877. Again, 808-591-4877. Thank you. We look forward to hearing from you.
Today, more than ever, we local people are living longer than any other state in the Union, with more seniors, baby boomers, and caregivers. Generations Radio promotes the importance to be proactive as we all age. The radio team will focus on issues facing our seniors and their families, finding resources to navigate healthy aging along with financial, legal, and caregiving information. So join Percy Ihara from 5 until 6 each Saturday, right here on AM 690, The Answer.
591-4777. Shoot-a-wah. Who's got the best deals in Vegas around? Call 591-4777 today. Vacations Hawaii. Vacations Hawaii. Vacations Hawaii. Good luck, we go play. 591-4777 today. Good luck. We go play.
Complete 4 and 5 night packages from $6.99. Vacations Hawaii, your favorite connection to Vegas.
Focusing on the issues facing our seniors and their families today. Here's our Generations Radio host, Percy Ihara.
So, if you guys recognize that voice, well, maybe you're older, 50-plus market guys may know that voice. You know who that voice is?
No.
See, I knew that. You're under 50. You gotta know his name. He's not on air anymore, but Frank B. Shaner.
Oh, yeah.
Oh, in fact, we did a baby boomer show for a little while, a couple years ago. Great guy. He's kind of semi-retired in Maui, and he's enjoying life, but he's healthy. He works out. He goes, Percy, how much crunches did you do today? How many planks did you do? It's so funny. We used to ride a bike together. He used to live near me. It's so small. Hawaii is so small. He found out he lived a block behind my house by Punahou. So we would ride our bike to Waikiki and back. Then we had to stop halfway and do planks and do sit-ups like that. Oh, Frank, come on now. But he's really good shape. I don't want to say his age, but he's up there. But yeah, Frank, if you're listening, hope everything's well on Maui in Kula. Anyway, as you guys know, like I said earlier, Benny and Faith Agbayani's on the cover. That's one thing I want to do when I get older is learn the ballroom dance. I love dancing. I'm sad that Rumors closed down. I was there the last month one time, but man, the crowd was so... I went the second week in January. They closed the last week of January. Did you guys go? Oh, you guys are too young. You guys still dance anymore?
No.
No, I was asking somebody, one of our millennial people that with the magazine, and I said, where do you go dance anymore? Nobody dances anymore. Back in the day, you guys, those guys, Jack and those Chaz got out there, we used to dance back in the day, right? The kids today, there's nowhere to dance, right? You ever been to Rumors? Oh, it's fun, right? Oh, old guys. After 10 o'clock, from when I would go 6 o'clock, and it would be like Earth, Wind, and Fire, Commodores in the 80s, and then slowly as you get to 9 o'clock and 10 o'clock, all of a sudden the music is faster and faster and faster, right? And at the end, they only play fast music. No slow music, no romance, no nice words. It means meaningful words. See, you guys don't quite get it. That's why if you watch TV today, a lot of these commercials, all these older songs from the 70s. That was the best era for music. They meant something, and they're catchy. Because I mean, I love hip hop and all that kind of other stuff, but not Hawaiian somewhat, but it doesn't mean anything, right? It's got to mean stuff. That's why Brother Is and all those guys and Kalapana and C&K, those songs meant things. Now, okay, next time you go Google it, or maybe you might know some of those words. It's true. It's very true. I was at an event, and this group played live with about 150 people. It was a special thing, and I was in awe of this group. And I was sitting next to a couple of girls in the 20s, and the girl tapped me on the shoulder and goes, "Who is that?" I know that song. I said, "That's Makaha's Sons." You know who Makaha's Sons are?
Yeah.
They didn't know who Makaha's Sons was. Like, oh my God. Did you grow up in Hawaii? I forgot. They're the millennials. They didn't really grow up with Makaha's Sons, but it take you back a little bit. And even you're only 40, right? 40. Yeah. You guys didn't grow up with the kind of music. It's like us guys did. So so what kind of music did you guys grow up with in the 40s? Well, you're not 40 yet.
Mostly like hip hop, I think.
Hip hop, yeah.
Yeah. Hip hop and Michael Jackson.
Oh, Michael Jackson. Yes. If you get a chance, go on Netflix. Because I had shingles. I was telling you I had shingles.
Yeah.
I was laid up for like 10 days. And I iced my body for 22 hours a day. I just get up for lunch, dinner, and breakfast. But I must have watched everything on Netflix.
Yeah.
Seriously. And there's a Michael Jackson, the last concert he was going to do was called This Is It. If you go on Netflix, try and catch it. It's about 3 hours long. It was a filming of the concert he was going to do, and he interviewed a lot of people. If you like Michael Jackson, you have people over for dinner and just play in the background. People just watch it for 3 hours. It's great. I did that. That's why.
Wow.
On Valentine's, made a barbecue for my wife, and then I brought like 4 couples over, and we all watched it. It was great. If you want to think,
that's a good idea.
If you like Michael Jackson, but anyway, we're here with Dr. Darren Awaya. I could talk forever, by the way, just like you, from Kuakini, Orthopedic. Brian, you say he likes to talk, right? Oh yeah, and he's a smart dude, man. He went to UCLA. But so when it comes to different types of back surgeries, I want to kind of drill down, because when you say back surgery, all I know is putting screws, or I didn't realize you said for like the nerve damage is not too invasive.
Well, for pinched nerves.
Pinched nerves,
yeah.
Really? I know a lot of people that have pinched nerves.
Yeah.
But so you said there's different procedures, but you said basically 2. But then you talked about your nerve and your legs and your back and your neck. That's all different types of surgeries, though.
Yeah, I mean, there's hundreds of different spinal operations, but the vast majority of the operations get boiled down into the same operation over and over again.
Right.
Probably the most common operation is a cervical or a neck operation for pinched nerve in your neck, pain that goes down your arm, and that's called an ACDF. That's an operation that's an outpatient type surgery.
It is?
Yeah, it can do the surgery and go home later that day or the very next day. People do well with that operation. It's probably one of the gold standard operations that most of us spine surgeons do. And
it's like 90%, 80%?
Yeah, that's the operation that we like to do because the patients do well.
And what causes it? Why do they come to you? Is it from a car accident or?
No, a vast majority of that is, again, degenerative. It's age-related. The disc, which is the shock absorber between the bones, ends up bulging. Much like your tire would bulge when it gets a little bit worn. And when that bulge happens, it actually impinges on the nerve. And that causes pain in your neck and down the arm. And that's where the saying, a pain in the neck, comes from.
Really?
Yeah.
Oh.
And so what we do is we take the disc out. And once we take it out, the pressure on the nerve is gone, and the pain usually gets better.
So you lose like 2 inches?
No, we used to. So the old surgery used to be take the disc out and leave them alone.
Really?
And
not anymore?
No, people would all get hunched over and their necks would be a little crooked.
What do you put in there?
So there's 2 options now for that. The first option is the standard operation, which is we put a piece of bone graft in. Historically, we took that bone graft from your hip, but that was much more painful than what we do now. We use an allograft that is basically a cadaver bone, or basically a harvested bone, that we place in between the 2 bones, or in place of the disc, and then it's covered with a metal plate for stability. The newest operation is an operation which is a cervical disc replacement, and so instead of taking that disc out and replacing it with something that doesn't move, we replace it with basically an artificial disc, and that's an operation that is quickly taking some footing and gaining some momentum here in the United States as well as here in Hawaii.
To replace that disc is a high success rate?
Yeah.
Really?
Yeah. It's similar. They've shown that the results are relatively similar, so it's sort of a dealer's choice as to which one you get or which one your surgeon feels more comfortable with. But there's options, basically. That's probably one of the more common operations we do. And then in your lower back, that's the other sort of focus of majority of pain in the neck, pain in the back. And the pain in the back usually comes from another thing like a disc problem. And similar pathology where the disc wears out, it starts bulging, it starts pinching on nerves, and we go in and take it out. We take out not the whole disc. Typically, we take out a portion of the disc, which is called a microdiscectomy. And the microdiscectomies are operations that are truly outpatient surgeries. You go home the same day.
That's what amazes me.
Yeah.
You know, technology and healthcare is. So my wife had our son, and had him like at 4:00 in the afternoon, and she said, "You can move out. You can go out by 9:00 next morning." Like I thought, I was going to stay like 2 or 3 days. Not anymore.
Yeah.
Less than 24 hours.
Yeah, it's the future of medicine.
It is.
Yeah.
Wow.
Yeah, so that's another common procedure that gets done at every hospital here in Hawaii. Spinal fusions are probably your next major workhorse of spine surgery, and that's when you develop that instability that we talked about, where the bones are rattling around in there and they're causing pinching of the nerves or back pain. In that situation, what we do is we put screws and rods in your back to hold it in place. It sounds archaic. It is a bit archaic, but it's definitely different than it was in the 70s, 80s, and 90s. The operations are much faster. The incisions are much smaller. The morbidity is less. And even those types of operations, in general, people stay in the hospital for about 2 to 3 days.
That's it?
That's it.
Wow. And how long are they like bedbound for a while?
Oh, you're walking the day after surgery.
You're
yeah,
walking?
The physical therapist will come to your bedside and get you out of bed, whether you like it or not.
I'm glad you brought it up because I had shoulder surgery. and since I had shoulder surgery 3 years ago, I talked to a lot of people that have had shoulder surgery. And why is it this? So you can correct me if I'm wrong and give me your opinion professionally or personally. When I had my surgery, I had PT the very next day.
Yeah.
I had 2 surgeries. Wait. So I've talked to a number of people. Even my sister had shoulder surgery. She had to wait 3 or 4 weeks, 2 or 3 weeks. And I said, why is that? Because you're supposed to let the inflammation go down or something? But why is that? There's 2 different theories of when to do PT.
Well, I think it's more dependent on what operation you had.
No.
So,
really?
Yeah. So I had, like I told you, I injured my shoulder. I had a chronically dislocating shoulder from surfing. Mm-hmm. And I had what they call an open Bankart repair, which is basically they slice the front of your shoulder open and they reattach the ligament or the tendon that's holding the bone in place. So sort of keeping the golf ball on the golf tee. And in those types of operations back then, they wanted it to heal before you started moving it. Because if you pull out the sutures, if you pull out the screws that's holding the tendon in place, you've basically undone the surgery. And so I did not have therapy readily after surgery. I was told to wait. I had other classmates in medical school who had the arthroscopic Bankart repair, which is like through the scope. And they were told to move right away because the morbidity of what was done was a little different. So I think the theory of when to start therapy sort of depends on the type of operation you have and the confidence that your surgeon has in the fixation that he provided you.
So if he's not confident, they'll tell you wait a few weeks.
They may tell you to wait.
Okay, so guys, if they tell you wait 2 or 3 weeks, you're going to find another doctor. No, I'm serious. I've had, there are people I talk, especially all baseball guys, they either get it cleaned out, take off all the bone spurs and everything, shave it down, or just reattach it.
Correct.
And both of them, some say wait like 2 or 3 or 4 weeks. Some say it went next day. It was very painful. I gotta tell you, going the next day, obviously right after surgery. But I'm thinking maybe is it because the doctor's older? He's old school, or is it new school?
Oh yeah, there's definitely different theories.
Okay, there you go. I think it's old school people.
Yeah, Kukini, we get you up right away. New school.
Oh, good. Well. And so, do you folks have your own physical therapy place, or you guys just refer it out?
Oh, in the hospital, the physical therapists are all employed by the hospital.
Oh,
and so after your surgery, you will see, people who know the protocols, who know the desires of the surgeons, and every surgeon's a little different. Mm-hmm. Once you're discharged from the hospital, you have two options. One, you could go to the rehab hospital or, a short-term rehabilitation facility, and you would then use their physical therapist. If you go home, we tend to have home PT, which is somebody comes to your house for a few weeks until you feel better. And then you would go to true outpatient physical therapy, where you go to the therapist's office.
But you guys have it on campus or both?
There is there's on-campus in-house physical therapy, and then there are therapists that are on the physical premise, but they're not employed by Kuakini.
Oh, okay, yeah. Well, we have the one in I always like to stay within the hospital because they know your doctor, the doctor knows you. You can trust. There's a big trust factor. But if you don't, home PT. I was telling you, the guy from USC, Kai, Dr. Kai, in our magazine is great as well. But so, how long is it the recovery period? That's what I'm worried about too. Because a lot of my friends don't want surgery because we play all year long in Hawaii, except for maybe December. But is a PT long, or the recovery period on back surgery? I can imagine it must be 6 months.
Yeah, let's take, to compare apples to apples, let's take a spinal fusion, which is a more invasive operation. It's common. It's sort of on the same magnitude as a hip replacement. So you can kind of get the idea of, they're putting something metal in your back, they're stabilizing something. The therapy for that, or the recovery for that, typically takes about 3 to 6 months. Now, the average person is out of bed in a day, but sort of limping around for a few days, taking pain medicines. Usually,
do they need a back brace?
Back braces are employed. Yes, we do use back braces, walkers, crutches, whatever sort of assistive device you need, just to get out of bed, because we want to keep you moving. The new school of thought is that immobility is the worst thing for you.
Right.
Complications with surgery happen with immobility. So then you tend to progress to a walker and some pain medicine for a few weeks. And then by about 4 to 6 weeks, you're sort of coming back into the office unassisted. Most people are driving themselves. Most people don't have issues with their wounds. And most people are sort of back to activities of daily living. At about 3 to 6 months, we, in general, will let you return to your normal activities. If it's play golf, if it's go surfing, you could probably do that.
Well, you said wounds from the surgery?
Correct.
So if it's on their back, do they have to sleep on their stomach?
Nope. There's no restrictions on the way you sleep. Yeah.
Really?
But about 3 to 6 months, you're kind of back to normal. Now, I had a patient. I was lucky enough to take care of one of the local physician's wives, and she
had mess up on her.
Yeah, exactly. It's your reputation is at stake. But her course was a little protracted initially. She sort of wasn't keeping up with what I thought she should keep up with, and it took her about a year to turn the corner. And it was very delayed, and she had, this and that. And of course, obviously it's, your peer's wife, and you worry more and stress more because you want it to come out perfect. I did her surgery about maybe a year and a half, 2 years ago. And I always, worried about her. And she just sent me a picture, a photograph in the mail for Christmas. And it was a thank you letter. And I hadn't seen her for 6 months, 8 months. I had almost sort of forgotten about her.
She's skiing or surfing or something?
She just finished the Honolulu Marathon.
Whoa.
So even if you have a spinal fusion and the recovery is 3 to 6 months, it doesn't prohibit you from taking advantage of very hyperactive activities, intense activities. So she ran the marathon with a spinal fusion, which I thought was great. And
wow.
I wouldn't have objected.
So that's one of the things when I got my surgery. I said, how would I be? I mean, how much strength will I have? How much flexibility? Because I play a lot, and how I'm always worried about, how can I get it back up to that same level of playing? And so she must have been pretty good.
Yeah, I don't know what her time was, but she looked happy at the end, so she must have did well.
So when you go home, do you need any special bed or a special crutches or what, a walker and things at home?
I think the biggest question after surgery is, can you get out of bed? How do you get out of bed? And the therapists at Kuakini do a great job of helping you mobilize and teaching you the right way. Now, unfortunately, not everyone can do it. Some people are older. We take care of patients that are anywhere from the youngest of patients to 80-year-olds, and they have a hard time sitting up. And we usually get them some bed rails or, teach the caregiver or the family member how to do it. If they're unable to do it, that's when we say you can't go home. It's just not safe. You're going to fall. Something bad is going to happen. And that's when we would send them to a short-term rehabilitation facility to, make sure they're better for about a week before they go home.
So question, firm bed or soft bed?
Firm
bed.
Yeah.
So, the reason I asked that because I really believe in sleep. And I try to get at least 7 hours of sleep every day, if not 8, nothing more than 8. But my wife gets like 5 or 6 some days. And I really like a nice bed. We bought a nice bed, but I went to one of these shows at the Blaisdell, and man, those beds like $3,000, $4,000, $5,000. We didn't pay that much for our bed, but we got a discount. But
yeah, I don't think a $3,000 bed makes you sleep any better than.
But they can go up and down, and they can. Only half of the bed moves, the other half can move. So your spouse you're sleeping with can have their own style of bed, and there's like these air springs. What do you call it? Have you seen those beds? Wow, they're amazing, the technology. But I can't believe I don't know how people can spend $5,000 on a bed.
Yeah, well, let me just tell you the quick answer of firm. It doesn't come from scientific research. It comes from talking to people. So I see people with back pain all day long, and I see people who have, issues with their neck all day long. And I always they ask me, what kind of bed should I get? And I said, well, what bed is more comfortable for you? And it's almost unanimously a firmer bed is better. So that's an answer that's given to me and to be relayed to other people.
Okay. So talk about the nerve. I know a lot of my friends, we play ball and golf, and the nerve damage or the nerve, just down the back of the leg. What's that big?
Sciatica.
Sciatica, yeah. Is that somebody's event? Dr. Sciatica found that problem?
I'm not sure where that comes from. Yeah. No, but I think that you mentioned briefly nerve damage. You said those words tend to be said to me a lot, and what I think that means for me is when you have a pinched nerve in the back, if you leave it pinched for too long, the nerve will die. And
the nerve will die.
Yeah, and then it's not a matter of unpinching it at that point because you can't resuscitate it. So
you can't?
No, you unpinch the nerve and it remains the way it is. So if people have a weakness in their foot, sometimes it's too late. So you definitely, we talk about non-operative treatment and surgical treatments, and you definitely want to adhere to the rule of you want to do something a little too soon rather than a little too late.
Oh, absolutely. We always try to be proactive in the magazine, trying to stay healthy and eat good, and all this stuff to stay out of the doctor's office, right? Even though I know you got to do a job and you got to get paid, and Kokini needs our business, but absolutely, right? So what's the best? Degenerative, of course, that's what's come with age, right? I used to be 5'10". My nurse girl says I'm only 5'9" now. I could not believe it.
Yeah.
I'm only 58. I thought maybe 70 you start losing some height. No. Since 50 to 58, I lost an inch. I said, that can't be true. She goes, it's true, Mr. Ihara. I said, really?
Yeah. You lose it through the cartilage and the joints. So they're normally pretty robust as a child, and they give nice, good cushioning, kind of like the tread on your tires, right? And over time, it wears out.
So any one tip? We got a minute to go. What's the best?
I think the take-home message for everyone is to stay active. I think that we are in a culture and a society of inactivity. And I think if you can stay active and get engaged in activities, you'll be better off.
Otherwise, you lose 2 inches instead of 1 inch.
Correct.
Anyway, Dr. Awaya, thank you from Kuakini Hospital Orthopedic, back and neck and joint there. I see in the magazine. Thank you so much. I appreciate that.
Thank you for having me.
And you'll see him very soon hopefully on KITV News. Anyway, thank you very much. Every Saturday from 5 to 6, Sunday from 3 to 4 on AM 690, The Answer. Aloha and live well.